I didn't do fascial manipulation basically because I've done a lot of other sort of extended scope courses in the past, and I just thought there was a bit missing really from it all. So I've done all the kinetic control stuff and lots of other sort of pelvic sort of rehab courses. And there was always there was a big group of patients that just sort of weren't getting better. And I spoke to Ian Lahidden about fascial manipulation, and he showed us some text and some books. And working with a couple of other people like chiropractors and stuff, looking at the whole body system stuff is an approach that I've took for much of my practice. But the understanding of the fascial system was, pretty small, and reading about it just fascinated me. And actually, the Stecco approach to treatment, they're trying to gather a load of evidence base for it as well. So it's not just like another manual therapy where somebody said to do it this way. They're actually a big institute with lots of kudos behind them as well. So for me, it was really to get an accredited course to give me extended scope of practice that's going to be safe and reliable for my patients. And since doing the first part of the course where we just look at CCs in one plane and things like that, I've had some remarkable results from athletes to chronic pain to people coming in from post-surgical treatments locally. All of those people have just got better so much quicker. And from a rehab point of view, when you're looking at sports and things like that and runners, you'd have to try and give them strength and conditioning for weeks and weeks and weeks that they're not going to be that compliant on it because they're not making progress. Where a couple of sessions of fascial manipulation, they make so much progress to their symptoms and stuff, they're right on board now to get on with their exercises and everything else. So for me, it's sort of revolutionised my treatments really in my practice, because for the benefit of my patients and the job satisfaction and everything, it's been fantastic, absolutely brilliant, it really has. Oh, it's fantastic. I mean, this time round as well, because obviously we're doing the more advanced course, and we're doing the second part, which is basically looking at multi-directional planes and things and treating them, called centres of fusion. Trying to grasp everything has been a much faster learning curve this time, because Antonio, he is just such a fantastic physician practitioner, and his knowledge is so great of these techniques. He's such a good educator, and then having Ian there to back up everything as well. He's been on, he's done the course twice, and then everybody in there is in exactly the same boat. The best thing is everybody is confidence is a lot higher. We're not putting anybody else down. Everybody's just happy to learn. The learning environment's just fantastic, really. I can't really say much more than that. Really, it's just been brilliant. There's a young lad. He'd come to me after being referred from a physio colleague that I knew, and basically, in a nutshell, he was running up to marathon distance, and then it was post-London Marathon about 4 years ago plus. He's not been able to run since because he was having sort of really excruciating pain in his feet and then pain in his hips as well. And it was generally a typical sort of overtrain and overload type syndrome, as people would have called it. But he'd done all the things with stretching, strength and conditioning, and he just wasn't really getting anywhere. So within 2 treatments of fascial manipulation, we'd got rid of all his foot pain. He started doing some running, and we were able to then get in and add strength and conditioning into there as well, and get him back to running in a pretty short space of time. So for him, it was really fascinating as well, because he was thinking about like becoming a med student, and he is. And so actually the anatomy and stuff we're talking about for him was absolutely fantastic. Yeah. Another person that comes to mind is a lady that had, she was, a 5 or 6 year history of what was determined sort of piriformis pain. Yeah, so she'd done lots of rehab, stretching and things, working around her piriformis, giving her lots of glute stability exercises to do, and it just wasn't going away. And she came to me because she was referred to see whether we could do anything from the foot up, because traditionally people think, well, podiatrists just do insoles and stuff. So we was referred for orthoses and insoles, but we do a full musculoskeletal screen on her, and part of that screen was a fascial assessment. And lo and behold, there was one line in particular, which is the lateral line of lateral motion was really positive in provoking her symptoms. So we did 2 sessions of fascial manipulation with her, and I did get a thank you card, and the thank you card in big letters said, "What piriformis, thank you," because she's actually pain-free and she stayed pain-free. So that's a great one for us, really. And I think, fascial manipulation, I think it's, and the fascial system just being so underrated, because it's a big force transmitter, it's a highly innovative system, and it's linked to every muscle, and basically when we're talking visceral fascia, every organ as well, and so we can't really ignore it as a treatment modality. It really does improve outcomes and our practice.